All right, well, good afternoon, everybody. Let me thank you guys for being with us. We're proud to be here with the nation's best First Lady, Marty Kemp. Sorry about that. I was trying to word that where I can include the First Lady of the House, Miss Dale Burns, who's always here with us. We appreciate that. Obviously want to thank the Lieutenant Governor and the Speaker for being with us today. We are here to announce new policy and budget measures that will build on the significant strides that we've made to make quality health care more accessible and more affordable for hardworking Georgians since my administration introduced the Patients First Act in 2019. Nearly 6 years ago, we began working on solutions that would put the needs of our citizens first. And our goals were very simple. Lower costs for Georgians with commercial coverage by stabilizing the marketplace and working to bring more insurance carriers to our state. And enhance access to care for able-bodied, low-income Georgians who did not qualify for existing health care programs and could not afford private insurance. On both of these accounts, Georgia Pathways and Georgia Access have been successful in improving health care options for Georgians. Both programs, working together, have in fact lowered costs for millions of Georgians who have private insurance, and also provided a pathway to coverage for thousands of low-income Georgians for the first time. These numbers speak for themselves. To date, Georgia Pathways and Access combined are providing health care coverage for over 1.5 million active enrollees. Over 800,000 of whom fall under 138% of the federal poverty level. And specifically on Georgia Access, over 216,000 enrollees previously did not have coverage through healthcare.gov. I also want to thank Commissioner John King, who's with us today, and his team, who reported that Georgia Access has now enrolled more new consumers than any other state-based exchange in the country. As a result of our combined efforts, Georgia Pathways and Access are covering well over 200,000 more Georgians than traditional Medicaid expansion would have covered, even under the most optimistic projections. I'll repeat that for all our friends in the media here today. Georgia Pathways and Georgia Access together cover 200,000 more of our citizens than traditional Medicaid expansion, with a lower cost to the state and better health outcomes for the enrollees. Furthermore, the overwhelming majority of these 1.5 million Georgians with health coverage, thanks to these two innovative programs, enjoy private insurance that fits their individual and family needs. And for the thousands currently or previously enrolled in Medicaid through Georgia Pathways, they are not just receiving health coverage. They are learning a skill, working, volunteering, or getting an education, all of which will help them find greater opportunity, start a career, and move off Medicaid onto employer-sponsored or private sector insurance. Our goal from the beginning has been to help able-bodied Georgians who need it the most become self-sufficient and pursue their dreams. Our innovative approach to changing how we provide Medicaid coverage to Georgians making less than the federal poverty limit has been the first and only kind due to the Biden administration's preference for the same tired government-run health care playbook. In fact, they have unfortunately been more interested in finding ways to stop or undermine our efforts rather than working with us. Through court delays and having to relaunch the entire program, the team at the Department of Community Health and my office have stuck with it and continue to find ways to improve the program and make it work for all Georgians. That's the great opportunity we now have as a state. With the second Trump administration in Washington, we will have a federal partner that wants to innovate, efficiently use taxpayer dollars, and ultimately deliver better care to the American people. That's why today I'm proud to announce that when we submit our Georgia Pathways Renewal application to the Trump administration in the coming months, we will be requesting a new qualifying option for the Pathways program to parents and legal guardians of children 6 years old or younger in our state. As working parents who have raised 3 daughters, Marty and I know just how time-intensive and important being a mother, father, or legal guardian can be, especially when it comes to helping those with difficult medical needs. Raising children in today's world is more difficult, and yes, it is more expensive than it used to be. For parents or legal guardians trying to get back in the workforce or provide for their families, lack of health insurance may be one of those challenges that is simply too great for them to overcome. In a growing state that needs more Georgians in the workforce than ever before, providing health insurance to a family or individual with young children may be the last piece they need to restart a career and be on a path for a brighter future. As I've said from the start, we will bring innovative and sustainable solutions to Georgia's healthcare needs, and we will do so in a way that is mindful of the long-term commitments to the state's ever-increasing Medicaid cost and prioritizes the needs of our people. And speaking of budgets and key healthcare investments, my administration has worked alongside our partners in the General Assembly over the last few years to strengthen the care we provide to new mothers. This session, I am confident we will continue that important progress, and I'm proud to say that commitment will start with my budget proposal for the fiscal year 2026 that includes an additional $3 million to expand the Department of Public Health perinatal home visitation program. We launched this program last year, and it's already saving lives and making a significant difference. In fact, last April, a perinatal nurse visited a new mother in southeast Georgia suffering from postpartum health challenges. Her young baby was found in a stage of hypothermia with life-threatening conditions brought on by a rare disorder. The child was rushed to the hospital, and its life, thankfully, was saved, all thanks to the nurse who made a home visit as part of this program. No matter your political party or personal philosophy, we can all agree that is a happy ending to a difficult story. And I believe we need to do more of this to ensure more good outcomes in our state. With the support of the men and women you see next to me and behind me, we will expand this program from 50 to 75 counties and significantly grow the geographic impact. That is something that we all can celebrate. My budget proposal also includes an additional $778,000 to expand cardiovascular services and high-risk care at designated perinatal centers, further putting our money where our mouth is when we say that we support life and families at all stages. So again, I want to thank the partners you see beside me and those all across the state who couldn't be with us, especially our frontline healthcare heroes, for all that they do and for the services they provide to Georgia's children, mothers, and families. I now want to call on Lieutenant Governor Burt Jones to share more about the measures and our ongoing efforts to make Georgia not just a safer and more prosperous state to call home, but also a healthier place to live, work, and raise our families. Governor Jones?
Appreciate it. Good afternoon, and I would also like to thank Governor Kemp for his hard work, his team's hard work on his Georgia Pathways programs. I am really excited after meeting with Commissioner King earlier, talking about the numbers that we're seeing coming in, people who are applying on our online program, the changes, the exceptions to the program, I think are going to benefit us. 2 years ago when I got elected to the Lieutenant Governor's office, one thing I said is I wanted to make access to health care more affordable and more ways that people, no matter the zip code, no matter the party affiliation, could access not just health insurance, but health care facilities. And that's what our people deserve. And it is exciting to see that this program, that the Kemp administration has been hamstrung the last 4 years because they've caught opposition from the Biden administration at every turn. And now with that release happening, with the new administration coming in, we're going to be able to add more people to the role. We're going to be able to cover more single mothers. We're going to be able to cover more caregivers. And we're also going to give people a hand up as opposed to a handout. And that's what we want. We want to help our future families and children, and I appreciate the governor's leadership on this. I appreciate the speaker's partnership on us reforming a certificate of need healthcare provision that I thought was an overreaching government entity. So we're going to keep working on issues like this. I think these are issues that Georgia families care about, and it's just good to have a united front, which we have right now, and got two great partners here, as well as a legislative body here behind me as well. So thank you, Governor. Speaker, floor is yours. Thank you.
Well, good afternoon. It's great to be here today and be joined by a governor who's focused on health care, to be joined by a lieutenant governor who's focused on health care, to make sure we provide health care for Georgians. And Insurance Commissioner, Commissioner King, thank you for what you're doing, joining with the members of the General Assembly as we all celebrate, really, the increased access to quality, affordable health care for the citizens of this great state. We certainly look forward in the House to continue to work with you, Governor, Commissioner, Lieutenant Governor, certainly, always a great partner as we continue that mission. There's nothing more essential to the quality of life of every Georgian at every stage of their life than their health. That's why this year the House will continue to work with the Senate and the Governor to continue to emphasize on supporting Georgia's mothers, our children, and growing families. We'll start by fully supporting your initiatives, Governor, proposed additions to the qualifying activities for the Georgia Pathways program. It's where it's working. These additions promote a broader approach to family-focused health care. By increasing the reach of Georgia's pathways to include parents, legal guardians of children under the age of 6, as the governor mentioned, who also meet the requirement income, an estimated 65,000 Georgians could become eligible for health care coverage. 0 to 6, as we all know, are the most critical years of early childhood development. And when families are healthy, children have a greater opportunity to learn, grow, and certainly thrive. The House is looking forward to working alongside Governor Kemp to promote the Pathways program success and ensure it reaches as many Georgians as possible. Thank you, Governor Kemp. We will also work closely with Governor Kemp and the Department of Public Health. Dr. Toomey's here to expand the prenatal home visit program, and certainly the commissioner here, Russell's here as well. This innovative and collaborative program currently serves expecting mothers in 50 rural counties, as the governor said, connecting them with the specialty care for cardiovascular, mental health, and other pregnancy-related conditions. This year, thanks to Governor Kemp's commitment to increasing maternal health outcomes, the House is on board and proud to support his $3 million investment to expand these life-saving services into an additional 25 counties throughout this great state, providing mothers with connection to services in every corner of our state. The House is also interested and wants to look very strategically at strategic investment aimed at supporting healthy mothers and babies by developing rural mortality and infant health care centers for excellence at up to 5 hospitals that currently provide labor and delivery services. relieving the financial pressure on these rural hospitals and strengthening our OB, GYN, prenatal, and postnatal services, especially in rural Georgia where these services are limited, will be a crucial step to lowering our statewide maternal mortality rates and providing every Georgia family with the opportunity to receive accessible care. These centers for excellence will provide rural hospitals that will allow them to sustain labor and delivery services, improve maternal and infant health outcomes, and support the overall well-being of the families who receive care, the communities where the hospitals are located, and our entire state. Finally, we know that securing a high-skilled healthcare workforce is vital to creating a healthcare system that meets the demands of this ever and growing state we live in. From women's health care professionals, pediatricians, psychiatrists, family physicians, and other specialty training, attracting and retaining top-tier medical talent will continue to be a priority for the Georgia House. To do this, we must increase opportunities for doctors to be educated and trained right here in Georgia. The data shows that nearly 75% of students who attend medical school and complete their residency here stay here. That's why the House will seek to strengthen our graduate medical education, GME, programs and partnerships throughout this state and increase the number of GME slots available for Georgia medical students. The success of our state depends on the health of our citizens, our families, and our communities. Working alongside Governor Kemp and Lieutenant Governor Jones, we'll continue to champion policies that increase access to care, strengthen our health care workforce, and support happy, healthy, growing families at every step of the way. Thank you all for being here. Governor Kemp, thank you for your work. Back to you.
All right, well, thank y'all again for being with us, and we've got time for a couple of questions. Yeah, that is my position. I mean, look, when you think about pathways, too, after the Biden administration tried to block us, we had to rewrite the program. We were tied up in lawsuits and everything else for 2 years. Then we got, the federal mandate for redetermination coming out of COVID. I mean, we've really only been a year into the Pathways program. And so we've learned a lot over the last year. The team, as you can see by today's announcement, I mean, we're going to continue to find ways to be successful. But at the end of the day, the people that talked about traditional Medicaid expansion, we have over 200,000 people more enrolled and on health care, getting health care insurance now or coverage than they said traditional Medicaid expansion would do. And most of these people on private sector health insurance that the government's not having to pay for. And the other thing is, the healthcare professionals are getting better reimbursements rates, and these families are getting better care. So what we're doing is working in our state. It is not easy. We're the first and only state to be doing this. I think now with the new administration in Washington, D.C., you'll see others looking at options like this, and we are certainly looking forward to working with them to see what else, if anything, we can do to continue to innovate. I mean, the old system is not working. And the other side, their only answer to any of this is they want government-run health care. And I am not in that boat. Yeah, I'll refer to any of the team that may know the answer to the number. If we don't have that, we can get that to you. But basically, you're going to be, the kids are available for Peach Care now on Medicaid. There's a lot of caregivers that are out there, or parents or guardians that are not being covered, and we want to allow them to have coverage just like their children or the guardian's children are having, and we can get that number for you. Well, we've had great conversations with the incoming folks. We're going to look forward to working with them. Some people would say that they are throwing cuts out there. You have other people say that they're going to make government more efficient. I'm in the camp that I believe that they can definitely find ways to make the federal government more efficient, look toward balancing their budget like we have to do here, getting into a growth environment, reining in the inflation of a 40-year high under the Biden administration. So, we don't know exactly what they're going to do. I don't want to speculate on that, but I can tell you this, we're having great communications with them already, and they're not even in office yet, and that is completely different from the prior administration or the current administration. Thank you all.
All right, good job.